Bismillah ar-Rahman ar-Rahim. Occupational asthma. This asthma is due to specific workplace sensitizers and may account for 10% of adult onset asthma. The diagnosis is often difficult to make. Early diagnosis is important as earlier removal from the workplace in affected individuals leads to a better outcome. It's different to asthma exacerbated by irritants in the workplace and and can occur in individuals with or without prior asthma. Agents induce asthma through immunological and non-immunological mechanisms. Immunological disease appears after a latency period of exposure. Thus, it is necessary for the worker to be sensitized to the causal agent. Non-immunological disease is characterized by the absence of a latent period and occurs after accidental exposure to high concentrations of a workplace irritant. This is irritant-induced asthma, previously named reactive airways dysfunction syndrome, usually caused by exposure to, for example, smoke, vapors, or fumes, with a strong temporal relationship between the irritant exposure and the development of asthma type symptoms. The latency between first exposure and symptom onset can be long and depends on the sensitizing agent. An accurate history, therefore, includes current and past exposures. Once sensitized, re-exposure to very low concentrations can provoke symptoms and may be associated with rhinitis and urticaria. Improves away from work but can take several days to settle. Risk factors of occupational asthma include atopy, HLA type, e.g., HLA-DQB1 star 0503 associated with isocyanate allergy, smoking, especially for high molecular weight agents. The diagnosis confirm the diagnosis of asthma, confirm the relationship between asthma and work exposures, find the specific cause. There are two useful screening questions to the patient. Is your asthma worse when at work? Second, does your asthma improve when away from work or on holiday? Document lung function deterioration in the workplace, usually by serial peak flow recording at work and at home and on holiday. Bronchial provocation and challenging testing using suspected agent only in specialized centers, but difficulties with testing and producing a valid test substance that a negative specific bronchial challenge in a worker with otherwise good evidence of occupational asthma is not sufficient to exclude the diagnosis. Skin prick testing and specific IgE for certain sensitizers, although a positive test only indicates the sensitization which can occur with or without disease. The documentation, the range of chemicals used, and look up the literature on their propensity to cause asthma, working practices, use of personal protective equipment, Serial peak expiratory flow rate recordings in occupational asthma record every 2 hours from waking to sleep for 4 weeks while no changes to treatment. Document home and work periods and any holidays. Analysis is best made by experts, usually using a criterion based analysis system, which is computer program that plots and interprets serial peak flow recordings. Patients may be sensitized to more than one agent, and 300 agents have been identified. Examples of causes of occupational asthma. This table explains the causes of occupational asthma. The left side is sensitizing agents, the right side is occupational or example of occupational exposure. Low molecular weight agents acts as haptens. Isocyanates, examples, paint spraying, adhesives, polyuracil, and foams. Acid polyhydrides, the example is epoxy paint, varnish, resins, and baking. Metals examples is welding, plating, and metal refining. Glutaraldehyde and other disinfectants. The example is healthcare workers. Drugs as pharmaceutical industry. High molecular weight agents such as amine dyes, and the example is cosmetics and hair dyes, rubber workers. Wood dust, bark, the example is textile workers, joiners, and carpenters. Animal derived antigens such as vets, lab workers, 20% affected. Biological enzymes, examples are detergent industry, pharmaceuticals. Plant products, examples are bakers and hairdressers. Lastly, fluxes and colophony, the examples are soldiers and electronics industry. Now, management of occupational asthma. We should first identify the cause, and the important step is to remove the worker from exposure, support continued employment away from the cause, if at all possible. Early diagnosis and removal from exposure are important factors for a good outcome. Improvement in FEV1 may be maintained for 1 year following last exposure and for up to 2 years for non-specific responsiveness. The decision to remove the patient from the workplace should not be taken lightly and should be made by a consultant with experience of occupational lung disease. And the employee may be eligible for industrial injuries disablement benefit, and no proof of negligence is required.